All right, ladies and gentlemen, we're back. Did you know that 40% of the male demographic suffers from gynecomastia? Yes, you heard me. Gynecomastia. It's, what is it? It's gynecomastia. You know what that is, gyne? You know what gyne is. It's, especially amongst teen boys, by the way. I see a lot of teenage boys with the boobies. I see a lot of the teenage boys with the boobies. And it's not like I'm cruising the internet looking for it. It's just on the street. It's on the street. I see the teenage boys with the boobies. All right? But Dr. Peter Bray is joining us. He's the first surgeon in Canada to use the BodyTite technology to treat gynecomastia. It sounds like you have a vagina in the middle of your chest. Okay? Gynecomastia. It's an unfortunate name, which leaves no... by the way, his method leaves no telltale signs of surgery. No telltale signs. How are you, Dr. Bray?
I'm just great, thanks.
Good. So this is a real problem with men now?
It really is. And the quote you heard, 40% is a realistic one. So it can be very common and a real problem.
What's the real problem with it? Because is it the fact that once a man forms a fully formed set of breasts, he no longer leaves the house? For many, many reasons?
Well, that may certainly be one of them. Or if they do, they have to take precautions in the way they dress, and can be, a real issue as far as self-esteem goes.
One of the symptoms is you start taking yourself to dinner and a movie. Is that one of the deals that goes on there?
Well, I don't know. It's a cheap date. Doesn't sound like a problem to me.
Sounds like a sure thing to me when you get home. All right. So it's certainly. Does it lead to any health problems when this happens?
No health problems in and of itself, but in some cases it may be a sign of an underlying medical problem. So it is important to get the attention of a doctor to rule out those things, and then there are options to make it better. Right,
because the next thing you know, you're talking about a special bra for jogging. Would you have to get a special bra for jogging?
Well, we all saw in Seinfeld the man's ear,
right.
So
right.
It's out there.
Yeah. Now, the thing that's particularly disturbing is this is common amongst teenage boys now?
It's particularly common in teenage boys, and that's often just a normal consequence of the flux in hormones, and usually gets better. But I think we're going to be seeing more of a problem as childhood obesity becomes more of an issue, because you gain weight and the chest gets bigger along with it.
That's the question I was going to ask you. Would it not be a better idea for somebody to start the day with 50 push-ups, maybe lift some weights to get rid of these things?
Absolutely. The whole lifestyle modification thing is still the most important. Attention to diet, attention to exercise, and working on chest definition. Mm-hmm. But most of the gentlemen I'm treating, they've been through that, and they just can't get the final edge on the improvement.
Have men ever gone down a cup size after their wives had kids?
I'd have to take someone else's advice on that one, but never done a formal survey, if you know what I mean.
Now, how does this operation work?
It's a new and advanced type of liposuction, but does a better job of both removing fat and the rubbery breast tissue that's important with gynecomastia, and it also does a better job of tightening the loose skin than older methods did. And it can all be done through a tiny incision.
So is this an outpatient deal where you come in for the day and it's done?
Yeah.
Do you have to wear a special garment afterwards?
Yeah, a chest compression garment, sort of like one of the tight vests the cyclists wear.
Right.
And that's for maybe a month or so. You can wear it under clothing, and it's essentially a one-stop treatment. Provided someone's weight remains the same and their hormones are stable, it's pretty.
So you could drop, I don't know, if you took a guy's man boobs away, you could drop, 10, 11 pounds probably?
For the real advanced cases, most people, it's probably a couple 100 grams.
Can you take the fat from the breast and put it into the penis?
It's technically possible, although never given that one a try.
Well, that's redistribution that I could buy into, my friend.
Well, we might have to have a private consultation offline about that one.
All right, because we are going to come in next week and shoot a video with you. Did you know that? Yeah, we're coming in to shoot a video.
I'm all over that.
I want you to do my left boob and Jordan's right boob. We think it'll be fun.
Well, you'll just have to make sure you're walking on correct sides of each other and kind of balance things out.
Yeah, we don't want to get confused.
Yeah.
How much does the operation cost?
It's roughly in the ballpark of about $7,000 or so. And
wow.
Yeah, unfortunately, it's not well, I'll say cheap
How much?
per se.
How much is a breast enlargement?
It's more than that.
Oh, okay, good.
Yeah. So the men are getting a better deal.
This is like going to the store and paying $300 for no roast beef. I didn't get roast beef today. Okay, that'll be $300. All right. What's your website?
It's drbrayplasticsurgery.com. That's DRBRAY plastic.
Thank you very much. Thank you,
Thanks
sir.
for having me.
All right.
Terrific.
Bye-bye.
Bye-bye.